We're all very human and fallible, and yet we live in a society that rewards pretending we're not fallible, or the range of acceptable fallibility is narrow.
We are constantly comparing our insides to other people's outsides and feeling inadequate and guilty, even ashamed.
Trying to blend in means parts of ourselves must disappear, and we must then live in fear that we will be found out.
Here, together, we will create a space where we can laugh, cry, and carry our suffering and hurts lightly.
In the service of being deeply human.
This is Life's Dirty Little Secrets. Welcome to Life's Dirty Little Secrets. I'm Chris McCurry.
And I'm Emma Waddington, and today I am so excited that we have Jennifer Kemp to talk to us about neurodivergence. Let me introduce you briefly. Jennifer? Jennifer is a clinical psychologist based in Adelaide, Australia, and works with people with mental and physical health issues such as perfectionism, anxiety, chronic illness, depression, eating and body image problems, and obsessive-compulsive disorder. Jennifer has a particular passion for working with neurodivergent adults, including those who have been recently diagnosed or self-identified. Jennifer presents internationally and is passionate about teaching clinicians skills in acceptance and commitment therapy, which both Chris and I are very passionate about too. And she is the author of 2 books, the ACT Workbook for Perfectionism, and soon to be published, the Neurodivergent Skills Workbook for Autism and ADHD, Cultivate Self-Compassion, Live Authentically, and Be Your Own Advocate. And it's going to be published on the 1st of July this year. Congratulations.
Thank you. I'm really excited. It's always really kind of nerve-wracking seeing your baby go out into the world. And I'm anticipating, as we were writing it, I was very much thinking about an autistic audience who would probably be potentially quite focused on accuracy and details. So it's like, oh my goodness, will they approve? It was definitely going through my mind. Yeah. It is exciting.
Amazing and so needed.
And so you found your perfectionism coming in there?
Yeah, look, and I get that a lot. I think other people sometimes still pick it up quicker than I do. This was the thing about this field though, Chris, was it's changing so rapidly, and the research coming out in the last few years is just turning on its head how people have understood autism and ADHD, particularly in the autism research space. So I very much knew that I had to write this as like a snapshot in time, that there was, in 5 years' time, there'll be new discoveries, new ways that the language would have changed potentially. So in some ways I had to let go of that perfectionism and go, okay, it's just for now. I know that I might read another article in 6 months that might not agree with this, but we just have to sort of go with what we know right now.
Well, that's why we have second editions.
Yeah. Maybe I'll get asked to write one. So Monique is my co-author, and she's also a podcast host, and she has the Neurodivergent Woman podcast. Yeah. So it was great to be able to collaborate. Yeah. It was great to be able to collaborate with her and like brainstorming what we should include in this book, because it's such a huge topic, really. So what were the key things that we felt that people needed to know?
Yeah. And so maybe let's kick off with a question that I asked you just before we began, which is, what's the definition of neurodivergence, and how is that different to neurodiversity? So obviously there's a lot of it.
Yeah, there's a lot of loose usage of language, and as an autistic person myself, I prefer to be kind of tight and consistent around my use of language. So it is a question that certainly is asked a lot. It's common around the world to say that a person is neurodiverse, and that is true because everyone is neurodiverse. Unfortunately, it's not really a word that discriminates between people, because we can think of neurodiversity is like any other form of diversity. There's an infinite number. Well, how many people have we got on this planet? 8 billion. So there's 8 billion different brains and bodies walking around. So to say someone is neurodiverse means that they're 1 in 8 billion people, essentially. To say that someone is neurodivergent means that they have some differences to what is considered to be the bulk of people in that 8 billion. And those differences they share with other people that can group them in a certain way. So one form of neurodivergence is autism, another is ADHD. But there are probably dozens of others. I have a list. If you can think of schizophrenia, giftedness, and all sorts of different. OCD is considered a form of neurodivergence now. Like there's so many different types. Epilepsy, for example, it means that your brain is processing information or firing in different ways. So it makes me wonder who is the neurotypical person walking around there, because I feel like I haven't met them. There's just everyone's got like some way that they're different from other people. And that should be celebrated, I think, rather than an assumption that there's a right way to be or like a normal person,
Absolutely. And lately it seems to be gathering more interest. Like we're talking about it more, which is a wonderful thing because we're raising awareness about it. I mean, I remember when I trained, especially when it came to ratios in autism, it was sort of, 1 to 4 individuals who were diagnosed with autism were boys. And the incidence was, I think it was, 1 in 1,000 at the time? It was quite low. We're talking a few years back. But now the interest has gathered and I see a lot more women who are curious about, assessments and diagnoses, and it just seems to be moving. It seems to be moving really quite quickly in the last, I'd say even 5 years. Do you know why?
Right,
yeah. Why is it? Why have we sort of gathered this momentum?
There's a few factors that have sort of, I guess, really captured people's imaginations. First of all, I think there's been a broadening of our understanding of what, if we just narrow neurodivergence to autism and ADHD and just sort of focus there, not deliberately overlooking other forms of neurodivergence. Certainly in autism, there's been this sort of broadening understanding of what it looks like in women, and that there's a sort of hidden or masked or internalized presentation that you might see in therapy that isn't accounted for in our diagnostic criteria. The diagnostic criteria themselves were very much written based on studies of white, wealthy American boys. Yeah. The sort of people who could pay to go and see a psychiatrist. So there's and even though I know that there's been some efforts to sort of at least include women in that, still they're very heavily weighted to what you would see as sort of an externalized presentation. And you'll often see that in children. Young children aren't aware that they're breaking social rules or that they're doing things differently to other people until they are. And that's when some kids will notice that they get picked on when they do a certain thing, or people look at them funny, or their parents tell them to stop moving like that. And then many autistic kids by sort of middle childhood, by about 11, have actually shut down and internalized that, and very much trying to socially fit in and not look different to anyone else. And then you take that and extrapolate that over the years, then any sort of autistic person who's socially motivated, that's just going to deepen that kind of performance, that the need to like suppress the parts of yourselves that are different can be it's just unconscious process that you're always doing. And that's where you'll see a lot of adult women and some men as well who mask, who hide the different parts of themselves, are now saying, hang on a second, if we understand this a different way, then we can, then actually that sounds like me. And I would say that the social media has had a huge part to play. And I know that you'll get a lot of people sort of blaming this as a TikTok phenomenon, particularly the massive rise in ADHD amongst adults. But every ADHD child who's medicated, for everyone, there's an adult that wasn't recognized. There's still this massive unrecognized adult population that are going through life with these differences that cause them difficulties. But it's not being caused by TikTok or YouTube or whatever. It's just allowed people to express their own differences in a way that other people can then recognize and then help people understand and recognize it in themselves. And a big chunk of the women who are being diagnosed are parents of autistic children, because now that we understand that this is genetic, then you're going, hang on a second, where did this come from? Maybe my child's actually quite a lot like me. I just don't show it. Or, I had the same difficulties when I was a kid, and it's become more acceptable, still highly stigmatized, but more acceptable to seek a diagnosis of autism and ADHD. And that's due to some amazing work by some advocates who've been out there at the forefronts, just being visible, being loud and speaking up. And yeah, it's been quite a wild ride. Like you, I had very little training, if any, in 10 years of training at university in psychology. It's all about kids when it was.
So true. And it's just, I was thinking as I was listening to you, the subtlety, right? If we think of the diagnostic criteria, it's not a very subtle criteria. But when we're in the clinic, I see people who describe themselves as feeling different. The experience of social isolation or even social alienation, actually, in some cases. And just having, and that masking part is the most painful, isn't it, really? Is this having to pretend that, or having to adapt, having to accommodate in ways that doesn't feel authentic, is where a lot of the mental health issues, because neurodivergent isn't the same as a mental health issue. And sometimes people get confused, don't they? Just because you are neurodivergent doesn't mean you have a mental health issue, but often they come together, but they don't have.
They don't have to, but there's a very high incidence of mental health problems, particularly anxiety and anxiety-related problems and OCD and depression. And then there are neurodivergent people are more likely to also have, or certainly autistic people, chronic health problems, significant lifelong debilitating, so layers of disability that overlap the problems that are, the difficulties that they experience. Yeah. Wow. So it is actually really common. This, I referred to by 11, there's a group of kids who have learned to suppress and fit in. And that there was a recent study by Bartok, I think, or something like that, but I have to look up the actual reference. Fantastic study where they followed a cohort of children from age about 5 to 11. And there's a group of kids in that group who had more difficulties expressing their needs, so communication difficulties. And by age 11, those kids were more likely to be acting out, and you can understand, so they'd have sort of conduct problems, behavioral problems that people were struggling with. And there was a group of kids, cohort within that group, who stopped stimming. So stimming is sensory self-stimulation. So it's like fidgeting. I've got a whole bunch of fidgets here with me. I've always got something I'm playing with in my hands, or, we play with our hair, those sorts of things. Those kids that stopped stimming, that group, 94% of them by the age of 11 met the criteria for an anxiety disorder. Oh. So it absolutely goes with it. It's not caused by autism, but it's certainly caused by an awareness that you don't necessarily quite fit in, or you say things a little bit wrong, or, there's, the little differences that you have definitely contribute to mental health. That study is incredible. I'll give you the link. You can put it in the show notes.
That'd be great. No, just the stress of having to live with not being as smooth within, social interactions, and, everything would just be that much more work.
Yeah. And I think, we have to be careful because there's still also an expectation that we have to be careful with our language. I have to be careful with mine here, because there's not, until recently, we've understood that autistic people have social deficits. That's been the language that we've used, and not as skilled socially. And some amazing research has shown that there's what's called a double empathy problem, that autistic to autistic communication is just as effective as non-autistic to non-autistic communication. It's where those two styles of communication interacts that the problems happen. And this is because the way we use language and our social expectations are different.
Yeah.
Autistic people have clear social expectations. And in therapy, Emma, you will hear people say, why don't people just do what they say? Or like my husband's just being so inconsistent, because autistic people base their social expectations on consistency, on fairness and honesty. And so we'll tend to, responsibility. We'll assume that people will do what they say. We'll tend to be honest when asked, even though actually the expectation is to sort of give a white lie. How are you? Good, thanks. Half the time it's a lie, right? An autistic person will be going, do you want me to really answer that question?
Yeah. What are you
What are you asking? Yeah. And autistic people tend to use language more literally too. So really focus on the language semantics, that having the right words, as we were talking about, that there's a specific meaning to them versus, non-autistic way of kind of also including there's the words, but then there's also what I'm inferring by my body language, or like I say one thing, but I mean another, like with sarcasm, right? And so we might miss sarcasm because we would just prioritize the actual meaning, the words that someone said.
I wonder if it would be helpful, because there's so much I want to talk about actually from just that little bit that you shared when it comes to sort of masking and mental health. Should we start by telling our audience a little bit about, well, not that we want people to sort of start diagnosing themselves, but what should we be thinking about, right? Because I think it is quite subtle versus, the manual that we're all trained in as psychologists. What should people be thinking about? What are sort of I was going to say red flags, but that makes it quite negative. I think, what is it that we should be, what is it that we would notice or feel or think that might highlight open us to asking about our neurodiversity or our neurodivergence?
And I would say, what would be sort of the signposts that would direct us toward answering questions, resources, educating ourselves, that sort of thing.
Yeah, sure. So in terms of what you're looking for, if you're a therapist or you yourself are wondering whether you're neurodivergent, obviously they're different depending on different forms of neurodivergence. So for ADHD, so autism, I have to see, you've asked me to talk about my special interest, right? So it's going to be really hard for me not to add like lots of extra detail into this. So just to say that autism and ADHD share the same genetic origins. They also share the same genetic origins as Tourette's. So there's a lot of overlap between autism and ADHD in real life, and about at least 80% of autistic people would meet the criteria for ADHD, and about at least half of ADHDers would meet the criteria for autism. Although a lot of clients that I've seen, and I've heard this from others, when ADHD is medicated and people kind of feel calmer and like more focused, that's perhaps when they might notice some more of their autistic things. So they're paying more attention to their experience. They come back and go, oh my God, I'm so autistic. It's like, because they're slowed down enough to kind of notice their sensitivities and things that they have. So in terms of signposts with ADHD, there's a sort of arbitrary line that carves off ADHD from autism in a sense. And those diagnostic criteria are based on executive functioning. So our executive functions are like it being able to initiate tasks and switch between them. They include all sorts of things like our inhibition, like being able to stop ourselves from just following our urges. We've got, what else have we got? It's a long list. A working memory. So the ability, see, I'm trying to hold these in my head as I'm doing them. So exactly that. My working memory is a bit average. So the ability to hold information in our head and then use it later. It's difficulties with organizing, prioritizing, planning and monitoring your own behavior. And emotion regulation. So our ability to manage and identify and self-soothe when we have emotions is also an executive function. So you will find ADHDers can still have difficulties with like big emotional ups and downs. And that, of course, would go with mental health problems, right? And in autism, I should say in ADHD, you will also find like a really strong focus on interests, something can really capture your attention. And I'm an ADHDer as well. I leveled up from autism to what we call ADHD. And so something is either like really interesting to you or not at all interesting to you. So if it's really interesting, it's not so hard. You can spend like hours on it. You can hyper focus, you would call it, and really dive into that, like whatever it is that you're kind of passionate about at the time. But that we call it dopamine mining. Like you get all these great feelings while you're doing it. And then it's like kind of the seam of gold like runs out and it's like, can't do this anymore. It's too boring. Moving on. That's a very typical ADHD pattern. And in autism, you'll see the same. Not for me to say. Not for me to say.
No,
This is a common thing I hear.
I get that. Yeah,
we were talking about like enjoying like winging it and not being too organized earlier. So maybe.
Yeah,
maybe
right.
you share that.
Yeah, I totally get that.
And with autism, well, you'll see also that same focus on interests. They do tend to be, it's called a monotropic focus. And I'd encourage listeners to look up monotropism. It's a fascinating field of theory of attention that I could also talk about for ages. Basically, it means you have a narrower and deeper focus. And so there's a real interest in understanding how things work, looking kind of beneath the hood, if you know what I mean, like what is actually going on in like how does this machinery work? Like tell me, I want to know all about history in this area. Like I love Taylor Swift and I want to memorize the song lists and know the origins of every single story. Like whatever it is, there's like a huge, like a deep, long lasting fascination. So with Taylor was recently in Australia. So everyone was Taylor crazy here. So it's a, easy example. If you were a Swiftie and you're autistic, then it might form part of a broader interest, lifelong interest in music or in something that, Taylor represents to you, some like lyrics or her use of language, or there might be something that links it to other interests that you have. And that would be this sort of long thread. For me, that's been psychology and how people, like how people work and think. And I've just been through many different iterations of that. But, it's never been boring. And we've already talked about like processing like social information and the use of language. The other differences are sensory, either sensitivities or hyposensitivities. So being like either really sensitive to stuff or don't sense it at all, including what's going on in our body and including our ability to read our emotions. So hyposensitivity or even hypersensitivity to our emotions, but autistic people may still be very aware of them, but have real difficulty understanding how they feel. And then also all those executive functioning difficulties are really there, so having difficulty achieving goals and so on, focusing attention and so on. So yeah, there's quite a few different signposts, I guess you would say, if you're thinking about whether something applies to you. And just to pick up on something you said earlier, actually certainly amongst autistic people, and I believe ADHD is as well, self-diagnosis, so it's called self-identifying actually, is considered valid. Because so many of us either cannot afford an assessment or there's so many barriers, because if you're autistic and you're a person of color or an immigrant in your country and English isn't your first language if you live in Australia, or, you're an Indigenous person, there's so many extra barriers to getting a diagnosis that self-identifying is seen as valid. And many people are turned away without a diagnosis historically because they're a woman or because, they've got a job or because they can hold eye contact.
Identification, the dark side of that is there's so much misinformation out there.
Yeah.
If you start Googling things, you can get into some very strange places. Do you have particular websites or resources that you find particularly good that you could give to us, and we can put those in the show notes along with your books and your website and all that sort of thing?
Yeah, sure. I mean, I think there are some excellent sources of information too, I would say. And of course, there's always going to be misinformation, but some of that's written in a book form too. So yes, first of all, I would send anyone who's curious to the Embrace Autism website. I'll send you the link to that and put it in the show notes. It's a website that's maintained by some autistic researchers, and in it they have all the key assessments really that you might want to put yourself through, if you like screening tools, and to explore different aspects of yourself, from autism and ADHD screeners through to executive functioning assessments. And they've also, which is so great about this website, they've also sort of put a commentary on there. They've looked at the research and they've said this seems valid because, or, they've sort of evaluated them and ranked them so that you can get a sense of whether this is actually good quality information. They wouldn't put anything up on there that wasn't. You can see the process that they've gone through to rigorously analyze whether this questionnaire can go on there. So that's a fantastic site. There are some fantastic YouTubers out there that are also psychologists as well. Mm-hmm. So there's Yosamdi Sam, is a autistic psychologist. There are some incredible, like How to ADHD is an incredibly helpful YouTube page, which looks at little bites of different things that you can do. There's, I think it's ADHD Love as well, and they've got books out and things like that. So there's some quite good information out there. And I think we have to I'm a psychologist and I put so many years of training into this, right? But none of it in autism. Unfortunately, psychology is still the profession stuck in a kind of medical model and a lot of gatekeeping around these terms, but it's pretty rare, I think. We have to be careful not to sort of completely gatekeep people out of identities that are helpful for them. If you don't view autism and ADHD as a pathology, but more of a neurotype, a different way people's brains working, then if people identify with that and that helps them support themselves in their life, then I don't see the harm of it. In Australia, if you want to get access to funding, you would need that formal diagnosis. But in your everyday life, if that's helpful as an identity, then I say go for it. Yeah.
That's been my experience, because I've, in my work, seen quite a few adults that, especially women, who in the last 5 years have I've seen them. They might present with a lot of anxiety, a lot of interpersonal issues, your typical client. But then we start to notice that actually things are really hard and they don't need to be that hard. That's what I tell them. Life doesn't have to be this hard. Like, they feel quite stuck. But that's, I think for me, the big signpost is, or has been, I'm sure there's many others, but for me in my clinical sort of journey is this feeling of different. Like there's just something that I'm not the same.
Yeah. The sense of everyone else can do this, why can't I do it,
Why is it so hard for me? What is it about me that I can't quite do this? And then there's that, just like you said, that, in those early years, we start to create narratives about that, right? That I'm defective, that there's something intrinsically wrong with me. That's the big one, is like there's something just wrong or broken about me. And that's why I can't do X or Y. And coming up with a neurodivergence can be very validating.
Yeah.
Well, that's been one of our themes in this podcast, is we're always comparing our insides to other people's outsides.
Very much so. Yeah. And as an identity, that there's very good research now just to support that certainly in autism, and I would say sadly that the ADHD research is a decade behind and has a lot of catching up to do. But in the autism research, the studies clearly show that a diagnosis in adults, a late diagnosis, leads to increases in self-compassion, an increased sense of belonging. there's that sort of sense of shared identity. So I do hear psychologists say this really relatively often, like, we shouldn't be letting people just diagnose themselves. And I think there's a difference between like identifying with something that makes sense to you. Just like we shouldn't be gatekeeping people regarding their gender or sexuality. Like if that's how you identify, then go for it. Then if this is your neurotype and you identify in this way, go for it. You still, if you want to try ADHD medications, you'll still need to have someone assess that and sign it off. But if it helps you understand who you are, I say, yeah, I think that's great. And I know what you mean about, the clients. It's just, everything's just so hard. And part of that comes from this pervasive, I don't know, have you come across this? It's a bootstrap mentality that they refuse to ask for help. And because I should be able to do this myself. Everyone else can do this. Something wrong with me. I should be able to do this myself. So I'm not going to ask. I should be able to keep my house tidy. So no, I can't get a cleaner. It's like, and it's so self-defeating. If you're not great at it, it's okay to get help. I couldn't do what I do without a massive group of people supporting me, honestly.
Well, I wouldn't have car insurance if it weren't for my wife, but you mentioned the 11-year-old, that age range. And in my experience in working with kids for many years, that is a very interesting age. It's in the States. It's about when they hit fourth grade, and 20% of boys just stop reading at when they hit fourth grade because it's harder. I mean, you're no longer learning to read, you're reading to learn, as they say. And everything becomes more complex. And there's a good 15 executive skills, and everybody's got one or two that trip them up. Mine is working memory. I have zero working memory.
Oh, it's so hard.
And so the work gets harder. You're not cruising along anymore, and the shame kicks in, and you quit, you bail out. And so that's a very tricky age for helping people stay, buoyant and resilient.
Yeah, I didn't know that statistic, but it makes sense that there is a shift there, isn't it? There's sort of, you need to do this reading in order to understand this topic, to be able to answer these questions, and
right.
Not
and
for fun anymore.
It's hard. And so you don't want to be seen as the dumb person who can't do this, even though it has nothing to do with how intelligent you are. It's a skill. And so, you take, you become very risk averse, and you shut down, and you don't mention things. You don't say, hey, I'm struggling, because that's a sign of weakness, and it's shameful. And so we need to be supporting people at that particular age to, get through that, and recognize that, it's hard work, and, you can get to the other side of it.
Yeah. And I'd say even before that, right? Because what are the messages that these children have received when they have asked for help, for example, that mean that they expect that, that they would feel ashamed for asking for help now. So, and when does that start? Because I don't envy educators and the job that they have to do. And there's one of you, and there's 20 or 30 young people in front of you. If only we could individualize people's education to a degree where it would suit the way their brains are working, and some people need more of a challenge, and some people might, some children might need more gentle encouragement and scaffolding, and like it's so hard. It is said, and there isn't this, I don't know where the actual origin of this is, that by the time they finish school, an ADHD has received tens of thousands of negative pieces of negative feedback. You need to sit down, sit still, stop wasting your time. You should try harder. You just need to focus more, like this sort of ongoing narrative of criticism from adults in their lives, their parents, their teachers. They've been teased by their peers for, their forgetfulness. They've felt the consequences of that. And yeah, it's unfortunately the outcomes for ADHDs and autistic people, that plays out across your life. You end up with more illnesses, or you end up getting into trouble, making choices that aren't the best ones for you or other people, that can go in all sorts of different directions. The research is very clear that the even lifespans are shorter for autistic people, primarily due to the burden of physical health problems.
Wow.
And for ADHDers, that to some degree, but more so because of a higher rate of accidental death and injury and self-injury and so on. Yeah.
What are some of the health problems? Because this is new to me. What are some of the health problems? I mean, I know there's a lot of, if I think of clients and sort of some of the research around gut and allergies, but what are some of these health issues? Because I didn't realize it was quite so severe. So significant.
Yeah, it is. There's, and yes, you're right about allergies, and certainly autistic people are more likely to have particularly autoimmune difficulties, but also things like being celiac. And so that's an autoimmune, inflammatory bowel disease, IBS, but also a whole bunch of chronic pain problems, musculoskeletal problems, hypermobility, postural orthostatic tachycardia, POTS, so dysautonomia. And so I think this is a really good thing that is commonly said, and perhaps one of the dirty little secrets we're talking about here is that autism is, described as differences in your brain. But if it's genetic, it's actually in every cell of your body. So you also have an autistic immune system and digestive system. Because if you think about the sensory differences, not just your central nervous system, your brain and your spinal cord, but your peripheral nervous system that's, feeling the world, I guess, through your nerves and so on, that is also perceiving it in a different way, potentially. So dysautonomia is the autonomic nervous system, and that's where your body isn't regulating. It's self-regulating. That's all the system that controls all the automatic parts. So processes like heart rate, digestion, breathing, body temperature, and so on. And so there is quite a high incidence among autistic women, and certainly a lot that I know who have POTS, which is a form of dysautonomia, which means all sorts of things, getting dizzy, getting tired, fatigue, brain fog. These are, all symptoms. So it's complicated. There's quite a few. I don't have the list. I have a long shopping list of things, even higher rates of cancer and heart disease by middle life, greater likelihood of weight problems. I'm realizing that your listeners here might be starting to either join dots or feel quite depressed. I think the earlier we can know these differences, that the outcomes are better the earlier we know. And so the earlier we can identify our differences, the greater chance we have to help people create a life that is self-compassionate, that is supportive for them, and works in a way that doesn't put their body under sort of this additional stress as well.
Well, yes, it sounds like stress is the big issue, which would be compounded by all those years or even decades of conflict with the world.
Yeah.
So starting with the liberation of recognizing that this isn't pathology, this is, who I am, and then taking steps to, self-care, would be, I imagine, hugely important. And part of that would be the self-compassion. And then, within the subtitle of your forthcoming book, this idea of living authentic, say it for me, because I'm going to stumble over it. Living
authentically.
There you go. Yes. And we spend a couple of minutes talking about that self-compassion and living authentically piece.
Yeah. realizing that you're neurodivergent gives you an opportunity to unmask to yourself, and even if it's not necessarily always safe to unmask and reveal that to others. So there is a level of privilege, that certainly I, white, cisgendered, educated person here in Australia kind of thing. It's like I have all these layers of privilege that allows me to talk about this. But even within your own decisions about like how you look after yourself, to live authentically is, I think, to honor and acknowledge your needs and to see those needs as having, those needs as being worthy of your attention and as equal to other people's needs. You will find, as in any kind of minority group, and the impact of minority stress is this sort of needing to people please, keep everyone kind of happy so that you're not going to experience further rejection and discrimination and marginalization in your life, and not be bullied and keep your job and so on. And so living authentically when you're safe to do that with others means asking for what you need and asking yourself for what you need too. There's a huge need for self-advocacy skills, to learn boundaries, to help people understand when others are not safe people, when people's intentions are not good, for them. And lots of work, even having, I help a lot of clients even advocate with health professionals. I write their doctor's letters. I write them lists of things that they can give to the doctor, because when they get in there, they can't talk and describe it, and they're under time pressure, and, helping people practically advocate for themselves, but, learning the skills to do that as well and speak up. We cover that a lot. We talk about in the book safe relationships and learning how to manage your emotions, because you might have heard of rejection sensitive dysphoria. That sort of fear of rejection, which is understandable when you had a lot of experiences of trauma and, rejection in your life. And at the same time as well, acknowledging that you need help, learning to ask for help, that it's okay to do so. It's valid when you're not great at something. That's okay. No one's great at everything, actually, and not helpful to compare yourself to those sorts of these unattainable neuronormative ideas, this ideal that pretty much no one can live up to be honest, hardly anyone. And certainly not many people who are in therapy are, finding that they're on top of everything in their life. So there's some things that are going wrong, and that getting support for those is absolutely not just valid, but essential. I couldn't do what I do if I didn't have a virtual admin, a bookkeeper, an accountant, a gardener, a cleaner. My husband does pretty much all of the washing. The only jobs I have to do is the cooking, and I can't consistently do that. My husband helps with the shopping. If I didn't have this support network, then I wouldn't be able to show up to work. I'd just be crushed by it all, I think. I just wouldn't be able to do it.
Yeah.
That, to me, that's an act of self-compassion, is to acknowledge that you're struggling and ask for help. So it's really kind of, self-compassion is any step that you take that is like asking yourself what you need and taking and giving yourself that, finding a way to support yourself, really, in the broadest sense.
Yeah, it's that permission piece, isn't it, really? That sort of knowing that, making room for the thoughts and feelings when something isn't going the way you want it to go or isn't feeling quite right, because that sort of story around it's me that's broken can lead to a lot of shame and hiding. But actually giving ourselves permission to have those feelings of a disconnect or feeling outside or struggling, finding something really hard, and opening up to that can give us some understanding of what we might need, and then give ourselves permission to ask for what we need, which is often such a huge step, because that shame
It is. And realizing that you're autistic and an ADHD does, those diagnoses, autism also have a lot of stigma around them. So it's surprising. I often hear that it might be fashionable, trendy at the moment. And certainly it's top of people's minds at the moment, but there's nothing trendy about an autism diagnosis, and so if people are seeking that out, it's because they're looking for some way of making sense of why things are harder for them. And it's once that sort of initial adjustment and grief, they've got through that, it's incredibly liberating to go, okay, yeah, that's just not kind of my jam. I just don't like noisy big crowds, and you know what, if I want to see my friends, I'm happiest on my couch playing games, it's okay. And that's just who I am. And I can let go of those ideals, those expectations, and create life in a way that, it might look different to what people think is the way you're supposed to do it. But that's a really lovely, beautiful, compassionate place to start that perspective.
And listening to you and your tribe that you have around you just reminds me of some, of the work that I've done over the years when people do find themselves identifying as neurodivergent or getting a diagnosis, to communicate it and find their tribe. And their partner sometimes over the years has been accommodating already. Like their partner is well aware of some of the difficulties, but sometimes they're not. And that has created a lot of disagreement and conflict and misunderstanding. And so, once we get to understand these parts of ourselves, we can then share and advocate for ourselves in our relationships as well, which is often a really important source of support and compassion.
Yeah, absolutely. And hopefully we receive it,
Yes, that's right.
And I feel really lucky in that regard, but, other people would, perhaps, receive a more negative response. And it is, it's a big adjustment for partners to go through too, to sort of perhaps, if they're already being supportive and accommodating, that's fine. There's plenty of people whose partner does kind of everything and they just do the work bit kind of thing, Yeah. And if that works and that's understood, then great. If you're expecting that person who's not organized with life admin is going to suddenly be organized with that sort of thing, then that's where the frustration and the conflict can come in. But it is a lot to ask people to change their expectations. Yeah.
That's right.
I don't do couples work myself, but I think that's definitely a very important piece of this. It's helping people understand each other and their differences and strengths. Yeah.
Absolutely. And their needs and how to find middle grounds and compromises.
Yeah, exactly.
Amazing. My goodness, I could talk for hours. I feel this has just been, just a really eye-opening. I've learned so much from this conversation, Jennifer. It's just really, I admire your knowledge, your compassion, your commitment to raising awareness. And I can't wait to get hold of your book, which I will have to wait.
Yes, pre-orders are available, but it just seems like a long way away, but it'll be here before we know it. Thank you so much for having me here.
And you'll get to hold it in your hands, which is such a thrill.
Isn't it? Yeah, really it is.
Well,
thank you so much.
Thank you so much, Jennifer Kemp. And again, we'll have your website and your book and whatever resources you can send to us. We'll put those in the show notes. And thank you so much. This has been, I hopefully very liberating for a lot of our listeners. And I hope that's what they take from this is like, wow, this is good. I'm going to go find my tribe.
That's right. Exactly right. Thank you.
Okay. Thank you.
Thanks so much for tuning into the Life's Dirty Little Secrets podcast.
If you have any feedback for us or secrets for future episodes, You can email us at lifesdirtylittlesecretspodcast@gmail.com.
Be sure to follow us on Instagram at Life's Dirty Little Secrets or on Facebook at Life's Dirty Little Secrets Podcast.
We invite you to follow, rate, and review us on wherever you listen to this podcast. It is the best way to get our podcast out in front of new listeners.
We'll be back in a couple of weeks with more.
See you then.